Hi, welcome to my podcast, Help Me Rhonda. I'm your host, Dr. Rhonda Karg. I'm a clinical psychologist, and each episode of this podcast, I present mental health related information to you in hopes that you'll gain insight into some of your behavior and also learn some new skills that will help improve your mental health. So, thanks for tuning in today. I'd like to talk about depression and what is depression? What are some of the causes of depression? What are some of the treatments that have been found to be effective for reducing the symptoms of depression? And some other resources that could help you if you are experiencing a depressive episode right now or in the future. So, a lot of people throw around the term depression, but in the field of mental health, when we talk about depression, oftentimes we're talking about major depression or major depressive disorder. And these are the symptoms. You don't have to have all of them in order to have depression, but these are some things to be looking out for. The first one, of course, is depressed mood. When you feel depressed or down most of the day, or you feel empty or hopeless most of the day. Not to say that your mood can't lift if something really good happens. A lot of people with depression can experience brief periods of time where they feel good, but most of the time, most of the day, nearly every day, they feel depressed or down. Another symptom of depression is loss of interest and pleasure in things that you used to enjoy. So let's say that you used to really love cooking and it was something that you looked forward to doing every day when you got home from work. And when you get depressed, cooking doesn't sound good anymore. Nothing sounds really good anymore. There might be a couple things that you still get enjoyment out of, but for the most part, you've lost a lot of interest and are getting much less pleasure in the things that you used to enjoy. So that's another hallmark symptom of major depressive disorder. Another symptom is what we call a disturbance in eating, which means that you're either eating much less or you're eating much more than you usually eat. And oftentimes this is accompanied by weight gain or weight loss. So sometimes we'll ask if you've gained or lost any weight as part of our assessment of major depression, because that can be an indicator of loss or increase in your appetite. Another related symptom is a disturbance in sleep. For people that have major depressive disorder, they can either sleep much less than usual, maybe they're only sleeping a couple hours a night and it's just restless sleep, or they sleep much more than usual. So let's say that a sleep disturbance is a symptom of your depression. You might go from sleeping 8 hours a night to sleeping more like 10 or 12 hours a night or more, or spending most of the day in bed sleeping. That's what we mean by sleep disturbance. Another symptom is having more difficulty concentrating. So if you're having a harder time following storylines in TV shows or movies, if you're having a harder time reading or paying attention to conversations that are happening, if your concentration is really suffering and it's accompanying these other symptoms of depression that I noted, then chances are that it might be a symptom of depression if it's gotten worse. Now, some people have ADHD and they have problems with concentration all the time. So what we're looking for in the case of major depressive disorder is that there's a change in the problems they're having with their concentration, such that it is worse during their depressive episode. Another part of that same symptom is having a difficult time making decisions about even little everyday type things like what to wear or how to spend your day. even little everyday decisions like that can be overwhelming and you have difficulty making decisions. So you may notice that as well if you're suffering from a depressive episode. Another symptom is what we call psychomotor retardation, which is when you're moving or talking much more slowly than usual. It's kind of like you're moving through molasses. That's the way some people describe it. And as like for the other physiological symptoms of depression, we have the opposite. So it's not psychomotor retardation, it's psychomotor agitation, which means that you're hyper, you're amped up, you're agitated, you're tense, maybe shaking and having a hard time sitting still, and can feel agitated as well. So that's another symptom of depression. And another symptom of depression is feelings of worthlessness, like you are a waste of space, that you're not a contributing to society, you're not doing anything to to make yourself a valuable person. And that's what I mean by feeling worthless. It's just like you have no value. Okay, that's another symptom of major depression. And another symptom is thinking a lot about death and dying. This can be range from just wishing that you would go to sleep and not wake up, or something more extreme about specific ways that you would harm yourself or try to take your own life. And that's another symptom of depression. It doesn't happen for everyone, but it does happen for a lot of people that are experiencing depression. So, what are the causes of major depressive disorder? It's really what we consider oftentimes to be a combination of genetics. So if depression runs in your family, you may have inherited the gene that makes you more susceptible to depression. And then a lot of times it involves a stressful event that can affect your levels of serotonin because of the adrenaline and the cortisol that's released in your brain, can essentially inflame your brain and make it so that you have depression. It's kind of like pouring Miracle Grow on any genetic predisposition, okay? And so it's usually a combination of a biological predisposition and a stressful event. But for some people, it doesn't need to be a stressful event. It's just uh, happens for them out of the blue. So there's not always something that triggers it, but a lot of times there is. And the treatment for depression is typically very similar, regardless of what caused the depression. The best treatment outcomes are with a combination of psychotropic medication like an antidepressant and psychotherapy. And the combination of those two together work synergistically so that 1 plus 1 is not 2, 1 plus 1 is 3. They work in synergy with each other. So medication is oftentimes discussed at some point during a person's treatment, depending on their openness to the possibility of taking medication. If you do take medication, a lot of times you might want to find out what other people in your family are taking for depression, and then you can maybe try the same medication that is working for them, because a lot of times if it's someone in your family, you'll respond well to the same medication that they're taking. And you can also get the genetic testing done. I talk about that in another podcast video about psychotropic medication or psychiatric medication. So you can check that out. Cognitive behavior therapy is, or CBT, you've heard me talk about that before. That is changing the way that you think about things, your perception of things, your reactions to things. And CBT is really the treatment of choice for major depression. There's a lot of studies that have shown that CBT is the gold standard for the treatment modality or treatment approach in psychotherapy to use for depression, as well as several other disorders. And other skills that are have been found to be useful with reducing depression is mindfulness or dialectical behavior therapy, or DBT. Those have been found to be very useful at reducing symptoms of depression. Other people find that physical exercise is all that they need if they need to run or exercise 5 times a week. Research shows that being physically active can be just as effective, if not more effective, than psychiatric medication. Some people rely on yoga and other forms of physical, exercise, just movement helps. But the yoga has like also a spiritual or emotional or mental component to it that sometimes gives an extra bonus to what you're doing. The movement that you're doing can also help increase or improve your mood, rather, if you do yoga. So those are just some of the things that you can do for the treatment of depression. If you have endorsed and can relate to a lot of the symptoms that I described today, I highly recommend that you look into this further, seek out the help of a mental health or other professional who can do an assessment of your symptoms to see if you do actually have major depressive disorder. There are a number of different depressive disorders, um, not just major depression. So going to a mental health professional will help tease that apart and see if you're affected by major depressive disorder or maybe one of the other depressive disorders that we didn't talk about today. So go seek out professional help, and there's lots and lots of resources on YouTube. There's lots of self-help books that are really good for depression. I would look for ones that focus on CBT or mindfulness informed approaches, but they make some really good workbooks out there, so you can read the reviews online to see which ones have the best reviews. But there's a lot of really helpful books out there that are based on research, that are scientifically founded, and you can go through those workbooks on your own. Or you can also watch some YouTube videos. There's some creators here on YouTube that do a good job talking about things that you can do to improve your depression, including me. I have a whole series of videos on things that you can do to improve your mood, so you can check those out. But the thing that I want you to know as I wrap up the video today is that there is help, and if you're struggling with depression, you're definitely not alone. About 60% of the adult population in the United States will experience a major depressive episode at some point in their life. That means that the majority of people experience depression at some point in their lifetime. So it is very common, and it's easily treatable when you find the right psychotherapist and you get started on the right medication. You sometimes have to um, use a couple different approaches to things. Maybe you would combine medication, exercise, and psychotherapy. Maybe those three things in combination that you might want to do. But there's lots of resources out there available, and at the bottom of the description for this podcast today, I'm going to leave some links to some workbooks that I recommend, and also the number, if you're feeling like you're in danger of hurting yourself or hurting someone else, there's a number called Lifeline, and I will leave that number in the description of this video today. Thanks so much for tuning in. I appreciate your support. I hope that you enjoy the rest of your day.